we will just jump right into it. We have a lot of awesome information to share. So just as a reminder of our guiding principles, safety is paramount. We'd like to minimize morbidity, focus on efficient distribution, and also access. And then underlying all of it, continuing to enhance their focus on equity. To kick us off, I'll pass it over to Tricia Washburn to give us an overview of the timeline.
Great, thank you, Mackenzie. Good morning, everyone. I hope everyone's doing well. So the estimated phase 2 timeline, the slide that is up on the screen now, this slide illustrates our progress in eligibility since we've started vaccinations in mid-December for phase 1 groups, where we are right now with vaccination among 60 to 64 and 16 and older with underlying conditions, and the final age band of 16 to 39 to open eligibility on April 19th. We were able to accelerate the timeline due to an increased doses of federal vaccine allocation to the retail pharmacy program and the federally qualified health centers, along with an increase in forecast allocations of Pfizer, Moderna, and Janssen vaccine based on the information that we received from the federal government. So as a reminder, this timeline is also partially based on 70% uptake in each of the age bands and does consider vaccination among people who may have been vaccinated in the earlier phases of our response. Between now and April 19th, we're going to continue to progressively open eligibility to different age groups, as you can see here on the timeline. So the next eligible group, which will be the 50 to 59, our aim is to open eligibility for this group by April 5th. And then roughly a week after that, we anticipate opening eligibility to people who are 40 to 49 on April 12th. And then, as mentioned, by April 19th, we expect to open eligibility to people who are 16 to 39. So while not everyone will be able to get an appointment on the first day of eligibility when it opens for their age group, we are very confident that most people in each age group will be able to have an appointment within a week or two after they become eligible. Next slide. So here, we review the progress through the age bands. Rhode Island, it's the data, as you can see here, Rhode Island has vaccinated more than 80% of individuals who are 65 and older, and for the around 54% for individuals who are 60 to 64. More specifically, the 65 to 74 age group, we're at about 84%. And it's important to note that as a state, we likely have vaccinated even more people in these age bands, as the Veterans Administration and Department of Defense have been vaccinating using similar age bands, yet they're not required to report to our state immunization registry, so their numbers are not included. We are working with our partners to assess their numbers to get a better sense of overall vaccination coverage, but we are doing quite well, and as mentioned, we are likely even higher than what we see here at the current time. So we will continue to ensure that as we continue to open age groups, we'll continue to ensure that anyone within these age groups who still wants to be vaccinated will have the opportunity to do so. Next slide. So here's a very colorful graph. Here is an illustration of all of the age bands representing individuals who have received at least one dose administered by each week that we've moved through since December. So right now we are continuing, as I mentioned, to vaccinate 60 to 64 and high-risk individuals, 16 and older. And in this age group, it's very large. Over 200,000 individuals are projected to be between the ages of 16 and 75, including those to have one or more high-risk conditions. The demand is still very high for the eligible age groups, which is fantastic. And in these bar graphs illustrate, you can see the color difference in the dip. So the lighter peach color is the 75 and older. And you can see when we open the eligibility for each of the age bands, you see a larger percentage of people being vaccinated among those groups. And we see that again when we reach an opened eligibility for 60 to 64 and high risk. Of course, it's a very, the category we're in now is a very expansive category. And so you see a variation in the ages across the board. But this gives you a nice visual of being able to identify when we opened eligibility and then the groups that were able to be vaccinated, the associated groups that were able to be vaccinated. So I think that's it there. Next slide. So great news here. We continue to have great momentum in our vaccination campaign. This slide illustrates, this is our administration rate for vaccine. So right now, Rhode Island is maintaining an average of 90% administration of our vaccine weekly. On the left side of the chart is February, when we implemented a policy where all of our vaccine providers would within a week, they received their vaccine inventory and within a week would administer at least 90% of their vaccine. And so once we implemented this policy, we started off around 62%. And let me just point out that when you see the dip, that's when that inventory is received into the state. So you'll have your inventory on hand you'll have your inventory on hand compared to how much we've received in the state. And then through the course of the week, our vaccine providers are administering that vaccine. And the expectation is that whatever inventory they received at the beginning of the week, they will use and administer at least 90% of that vaccine by the end of the week. And so that's why you see that dip. But you'll also see that the trend moved upward pretty quickly. And since March, we have been meeting and exceeding our goal of administration. So, and this is also, I should mention, this is an expectation not only among our vaccine providers that are getting state allocation, but it's also for our pharmacy partners or our federally qualified health centers that are getting federal allocation. So a big shout out to our vaccine sites. They're doing an amazing job. And it's, it's just wonderful to see the vaccines coming in and we're getting it right out. And that's a huge thanks to our vaccine providers for meeting those goals each week.
And I just wanted to say good morning to everyone and jump in there before we go into our educators, see if anyone has any questions thus far on what we have shared. This slide is important for highlighting our effectiveness with implementation. When we told you after our switch from phase 1, which was more targeted, and we had the 14-day effort to make sure we got vaccine out to all of the multiple partners. We achieved what we needed to and then shifted to phase 2, where we said we would shorten that time frame to 7 days getting vaccine out and really accelerate. We have been able to achieve that effectively as well. And it is, again, true kudos to the entire team and to all of you as ambassadors in helping to really push, because our demand continues to be high and we are excited about that. We definitely want that to continue, which is why we have that 70% goal for getting through each of the age groups as we advance, where other states may not have a goal as high. So any questions there?
Just a comment, I keep checking the Times website and Rhode Island looks like top 5 states for fully vaccinated. So that's just fantastic as of this morning. Great job.
Thank you, Dr. LaPlante. It is huge for the team. Even when the grades weren't good, as we've said, the team had a lot to be proud of because we knew what we needed to achieve and achieve that. And as the grades are good as well, we're just as pleased and we're going to keep going strong. All right.
Great. I will pass it over to Alicia to take us through some of our other populations.
Thanks. Good morning, everybody. Thank you, Dr. Alexander Scott, for that perfect segue about the 70%. So as everybody knows, there was a presidential mandate that we vaccinate teachers, school staff, and child care workers. And so we were able to pivot very quickly and reallocate vaccine to achieve this mission. And based on the enthusiasm of this community to get vaccinated, we were able to leverage multiple channels of our vaccination strategy in order to get them vaccinated. So our municipal partners stepped right up and created new clinics to be able to vaccinate exclusively folks who work in their communities. The pharmacy partners also absorbed a tremendous number of individuals who work in education. And so we anticipate that 81.5% of teachers, school staff, and child care workers were vaccinated either right before because they were eligible in other categories or during the month of March in order to achieve this initiative. So first doses are in arms for the majority of the community, and we will be rolling into second dose clinics starting this weekend. So we are very excited that we were able to support this initiative so quickly. And we think that we've had, again, very similar success in achieving the goal. Next slide, please, Mackenzie. As you know, we've spent a lot of time really focused on some folks who were in a position to have the worst outcomes due to COVID. And so we initiated our process with your support in terms of older adults who are living in congregate settings. And we worked with CVS and Walgreens as part of the CDC's pharmacy initiative to get individuals who live in initially nursing homes and then shortly thereafter assisted living communities, HUD 202 sites, and adult behavioral health care group homes, excuse me. And so we have now wrapped up that initiative. We have close to 53,000 people who were vaccinated through that initiative. So older adults who are living in congregate settings and the staff who support them. So we were very excited about the progress that we were able to make on that front. And we now have contracts in place with 2 vendors who will be maintaining the vaccination status of any new residents who will be either newly admitted or anyone who received a first dose someplace outside of the nursing home and then comes in and needs a second dose. So we will ensure that that opportunity continues to exist so that we can maintain high levels of coverage of vaccination inside nursing homes and assisted living communities. We also have vaccinated more than 4,000 people at over 80 elderly housing sites that are outside of the long-term care partnership, and that initiative continues as we work with our municipal partners to identify other places where folks may need to be vaccinated. We have seen that a number of people, as we approach those opportunities, have been vaccinated elsewhere as part of other initiatives, as part of the strategy, which is fantastic, but it also continues to provide us an opportunity to vaccinate people in place. Our behavioral health and intellectual and developmental disabilities group homes, as you know, were highly prioritized initially as part of this process, and we have continued to vaccinate not only for individuals who live in group homes, but individuals who are living independently and receive services, as well as the folks who provide care to them. So we have vaccinated more than 6,000 people through that initiative with the help of our the Rhode Island Disaster Medical Assistance Team and Medical Reserve Corps. Still in process, we have recently begun vaccinating down to age 16 through some of the programs through the Executive Office of Health and Human Services to try to capture other individuals with Pfizer vaccine because we have that opportunity so that we can get some of our youngest members of the community vaccinated. As you know, we launched about 5-ish weeks ago now, a sign-up process for individuals who are unable to leave their homes to get vaccinated. And we, again, have signed on 3 vendors to help support the process to get individuals vaccinated, as well as we've been working with some of our home health agencies that do provide vaccination to ensure that we have good coverage of individuals who can't otherwise leave their homes And if their caregivers are at risk and can't leave their homes, we want to vaccinate them too. So over 1,000 doses have been administered to folks in this group so that we can continue to protect them. That list grows by about 100 people every day. So it will be an ongoing process, and we're really, now that we have the vendors on board, are working actively to try to work through that list as quickly as possible. And then finally, individuals who are experiencing homelessness have been an area of focus for us since phase 1. And the Rhode Island Coalition for the Homeless was very, very supportive of this process and was able to create some strong opportunities for us to bring people to a select number of sites in order to get them vaccinated. And so that process, again, is ongoing, but about 600 people who receive services through the many different types of providers that we have for individuals experiencing homelessness have been vaccinated through that initiative. So we will continue to work with them. As we know, individuals experiencing homelessness, unfortunately, is not a static number of people and is ongoing. So we will continue to work with those partners to ensure that we have an ongoing process as new people begin to experience homelessness. At the bottom of this slide, we just have the information. If you or any of your partners are aware of anyone who is unable to leave their home in order to get vaccinated, please utilize the link there. It is available in 3 languages, English, Spanish, and Portuguese, so that we can track where individuals need to be vaccinated. 211 is also available to support sign up for several of these initiatives, as is our hotline, which is 222-8022. Thanks, Mackenzie.
I see a question here that from Dr. Chowdhury that we could maybe answer right now. She asked when we might consider vaccinating companions of high-risk individuals, as this comes up at vaccination sites often.
Sure. So we have been actively discussing that, and we hope to be able to put out some guidance about that in the next week or so. I'm sorry, for individuals who are homebound, that is already part of our process. Folks who have a caregiver who is unable to leave or would be at higher risk for leaving, we have implemented that process, but we are looking at expanding that opportunity.
And then there was another question in the chat about who the RIDO partners are for homebound shots. And just I'll read it out that Tricia Washburn responded that we have selected 3 vendors, PACE RI, MedTech Ambulance, and Alert Ambulance to help support that effort. I will now pass it over to Sheena Gordon to talk to us about HTCs.
Thank you, Mackenzie. Good morning, everyone. This slide really talks about the need to increase the vaccination rates, not only in our HDCs, our high density communities, but also along the BIPOC community, and that's Black, Indigenous, people of color. We know that those rates, vaccination rates, have lagged behind, particularly the hospitalization rates, but in some cases, even the population rates. And we need to be more strategic about how we are looking to increase the vaccination rates in these communities. We think at this point, the approach will be 3-pronged, if you will. The first part is continuing to increase the allocations that are going to those HDC only channels. The medical providers and community-based organizations that we currently have vaccinating in the high density zip codes. Additionally, we are adding dedicated days at the RIDO Vaccination Center. So last week we had our first HDC day. There's another one tomorrow, actually, April 1st. And we're looking to make that an ongoing Thursday, where every Thursday, particularly at the Dunkin' Donuts Center, but we're also looking at opportunities to expand it to other RIDO vaccination centers to have dedicated HDC days, where those links will be sent privately. They wouldn't be on the Vaccinate RI website, particularly so that we can help people who have technology access issues and would need to call in or otherwise communicate with someone to get signed up for a site. The other thing we've done is expand the eligibility so that the HDC eligibility applies to the right-of vaccination sites, even outside of those dedicated HDC days. The third part of that strategy is continuing to partner with retail pharmacies. And this is there are two parts to this. One is to work with the pharmacies to identify mechanisms to reserve slots and to find ways to target their patients and customers who live in HDCs and are represented in the BIPOC community, as well as supporting our place-based vaccination. So the pharmacies have done a lot with our senior residences and other residential facilities, and we're also going to be using them in the near future to support additional community-based vaccination events. With these three things, and probably other things as we get more creative and find additional solutions, we have the short-term goal of vaccinating approximately 40% of HDC residents and people in the BIPOC community. That approximates the percentage of hospitalizations that they have had relative to the rest of the population. And obviously the same with every other population, the long-term goal would be those herd immunity vaccination rates of 70 to 80%. I think this slide is really helpful because it shows, the need to increase the access beyond just the HDC channels for these populations. And so you can see the number of first doses that are coming through the HDC channels relative to particularly the mass vaccination centers and the pharmacies. Hospitals and other medical providers have already been asked to prioritize their patients who live in HDCs, both tier 1 and tier 2 high density communities that have underlying health conditions. But we think being able to also access the doses at the right of vaccination centers and the pharmacies through targeted efforts will help to increase the vaccination rates in the HDCs much quicker than what we would be able to by just using the HDC channel to address this population. So here's a look at kind of how we are thinking about the HDC strategy from this point forward. We actually have started to kick off our conversation with the tier 2 municipal leadership teams. So expanding our efforts beyond tier 1 and into tier 2, continuing our work with HES partners to think about where those cold spots are in our high density zip codes and how we can stand up vaccination sites either ongoing or on a pop-up basis to address those populations. We're working to increase the capacity of our medical providers that are currently serving in tier 1, but also identifying additional providers in tier 2 that could help with vaccinating those residents as well. And then continuing our work with the community health centers to make sure that they're positioned to prioritize their patients and other members of the community who live in the tier 1 and tier 2 HDC zip codes. For community-based organizations, we are starting our outreach to tier 2 partners to identify people who would be willing to serve as either pop-up or ongoing clinics. The other thing in terms of the place-based vaccinations, which we talked a little bit about, so that would be someone going into a church and vaccinating the entire congregation, or going to a food pantry, vaccinating everyone who's receiving services there. We're looking for partners for that. Where we can target not only our tier 1 and tier 2 zip codes, but also BIPOC residents who may be receiving those services or are a part of that constituency base as well. And then partnering those community organizations with our vaccinators, the wellness company, and the pharmacies, and operational support, whether it's municipal volunteers, the Red Cross, or other organizations that have graciously stepped up to the plate to help in this effort. We'll be continuing the work that we do with pharmacies in terms of the housing and place-based vaccination. And then we're working with particularly CVS, Walgreens, and Walmart around ways to reserve slots that can be targeted to our HDC and BIPOC community members. And then for the right of vaccination sites, as we talked a little bit about, we'll be expanding the HDC days to target tier 2 residents as we roll out the tier 2 strategy. and then determining what the appropriate timing is for that to make sure that we're able to align all of tier 2 to move in concert when we do expand that eligibility to the tier 2 zip codes.
Thanks, Sheena. I know we just ran through a lot. Does anyone have any questions or comments about any of the HDC information?
I just had one question, and that's about the second shots, the second doses. Is there a strategy in place to do follow-up on second strategy, particularly where we're using these unique methods? And let me just start by saying great job, Sheena, and to the whole team for everything you're doing. I know how hard you're working. But I just was, as I listened to the unique strategies to reach out to this population.
Yes, today is school, right?
So that's my question.
Yeah, good question. We are attacking that a couple of ways. We are encouraging all of our partners to set up second dose clinics so that we are using the time of observation as a time when people can sign up for their second dose slots. Those people who are either missed through that process or for some reason, don't make their second dose appointment, with the going out to people who, to make them an appointment. For people who we have been able to accommodate, call-ins, particularly through the Beat COVID and 311 hotlines in Providence, Pawtucket, and Central Falls, to partner with them with an opportunity to join an existing second dose clinic. And the definition, I just saw in the chat, the definition of an HDC, it's high density communities is the actual acronym, but what it really represents is those zip codes that have been most impacted by hospitalizations, infection rates, and in the worst cases, deaths across the state of Rhode Island. We know that in those communities, there tend to be higher concentrations of people of color, lower socioeconomic indicators in terms of, income and education, much more densely populated, both in terms of the housing type as well as multi-generational households. And the density is one of the things that we're contributing to sort of the spread, but we know that there are other issues around healthcare, the way people would need to access work, a lot of the people being essential employees, not being able to sort of work from home or take the same time off as exists in other communities. And so we've tried to, not only through the vaccination efforts, but also through testing, treatment, and community mitigation, find ways to decrease the spread of COVID in these communities. And vaccination is really just a part of the full strategy there.
I have a question. Are there any specific strategies that are being utilized to facilitate those who have been vaccinated to act as ambassadors in their community to help convince other people to get vaccinated?
Yeah, there are some interesting things happening. I'm not aware of too many directly through RIDO. I know that there are a couple of community organizations that are doing thought pieces with people who have been vaccinating and getting them to come on the radio to share their stories. I think that there's probably opportunities for us to identify more ways to sort of use word of mouth as our best advertising here to say that, if you've been vaccinated, share your story, talk about, how you still feel safe and healthy, and that being a way to get more people to come out to be vaccinated. One thing that I will say that we have seen, and it's particularly true in Central Falls, and we can see it because it's been open there so long, is that we did sort of get to a point where we were dipping in terms of demand. And I think as people started to share their stories and started to talk about, getting vaccinated and how they're still healthy and they're fine and the process was good, that, we saw demand start to uptick there. So I think that there's true power in that word of mouth and sharing the stories of people who have been vaccinated.
Sheena, do you want to go in a little more on what's being done in Woonsocket as a starting point to answer Dr. Chowdhury's question?
Sorry, I missed the question.
Would an area like Woonsocket be prioritized? So definitely, yes, as they are part of our tier 2.
Absolutely. I think that's part of the reason of moving to tier 2 is that, you know, we're starting to we're still seeing activity, right, of the COVID-19 virus in those areas. So we're opening the Woonsocket mass vaccination center. That creates sort of a very local opportunity for us to target those residents through HDC days and the like at that mass vaccination center. Additionally, as we kick off the meetings with the municipal teams, we're working with them to identify kind of the low-hanging fruit in those places where we can stand up vaccination clinics quickly to be able to target those places. So Woonsocket's definitely a priority. You know, as we think about all of tier 2, we want to try to move in concert as much as possible, but it's definitely a priority for us given sort of the current state of the virus in that community. And I think I just saw a question come in that asked about the tier 2 zip codes, and Alicia has posted those, and the zip codes are in the chat just a little bit further up. She posted at 7:57 a.m. But I can just read them off. It's 02906, 02910, 02919, 02911, 02914, 02920, 029,893, 029,895. So those are the tier 2 zip codes. Thanks for following up on that, Alicia.
Any other questions, comments about HDC and BIPOC strategy specifically? We have another slide or two, and also hopefully have some time to get through some of these comments for a public comment period.
Hi, this is Larry Warner. I had a question about a population or workforce that's sort of at the intersection of several groups that's been prioritized, and it's after-school providers, which was initially left out of the educator and licensed child care provider group. I was wondering if there'd been any additional conversation about, as we look forward to summer and thinking about the workforce needs to support summer programs and currently the after-school workforce, which is highly represented by BIPOC workers, just thinking about if there's been any conversation about opening up vaccination to that group.
Alicia, do you want to take that one? I can perhaps flip back to the timeline, which I think helps us think through how we're going to open up to some of these other groups.
I'm sorry, Mackenzie, I got so caught up in retyping zip codes.
Oh, no worries.
Can you repeat the question?
Yeah, the question was around after school providers and other child care providers that maybe were not included in the effort to educate vaccine educators, and just the concern around summer camps and summer programs and how we're going to support those folks.
Yes. We are, because we are on the accelerated timeline at this point in time, we anticipate that, by April 19th, we will be open to everyone who is eligible. And so, everyone will become eligible, everybody 16 and older, so that opportunity to set an appointment to be vaccinated will become available very quickly over the next few months. And so we're hoping that includes folks who run summer programs, and they will be able to be vaccinated as soon as that eligibility opens. Obviously, it's going to take us a little bit of time because the vaccine demand is high, which we are thrilled about, but we are excited to be able to open that opportunity to everybody.
And I think the other important thing to add there too is not just that we're expanding eligibility, but we're on track to be able to vaccinate about 70% of everyone that's eligible by mid-May. Now with our 16 and 17-year-olds, because there's only one vaccine that they're currently eligible for under the EUA, So we're working on the specific timing there, but on track for 70% of everyone that's eligible by mid-May.
Thank you.
Okay, to wrap up the content for the day, Alicia, do you want to talk to us about the vaccine interest notification list?
Sure. So this is an initiative that we launched several weeks ago to ensure that individuals had the opportunity to express their interest. We've been utilizing this every time we open a new eligibility group, including the age bands, to notify folks of where we are in the process. We have recently changed this opportunity, as Tom announced at the press briefing last week, to ensure that we have some protected spaces for folks who have identified that they are interested in getting vaccinated. So when we have new appointments available, folks who are on the list will be notified in their eligibility group, and we'll have a time-limited and one-time use link to sign up for an appointment. It is a little bit directive in that it shows you, where an appointment will be available for you and on which date. And if you are interested and available in that appointment, then you click the link through your email or text, and you are able to get your appointment all signed up and ready to go. So we are really excited about this opportunity because it allows us to prioritize the folks who have expressed interest. It will not be used for all of the appointments. When we announce our appointment openings, those will still be available to folks who are not on the list. So it does not exclude anyone who is not eligible. I'm sorry, or it does not exclude anyone who has not signed up. And it will, we hope, help facilitate the process and help us measure demand so that we can continue to see how many people are interested in being vaccinated and provide those opportunities in a timely manner. This list has also been utilized by our state mass vaccination sites and our municipal partners to continue to prioritize. We get a lot of questions about what happens to doses at the end of the night if we've already tapped a vial. This list is used to contact folks in terms of trying to find individuals who are interested in getting vaccinated and get them to those sites to further be vaccinated. So we're looking forward to just the opportunity to help us, again, measure demand, expedite the process for folks to get signed up to get vaccinated, and provide additional opportunities. We have, as you know, many additional partners who are vaccinating, lots of retail pharmacies. We are bringing on 3 regional sites starting next week that will be run by our municipal partners. And so again, it just creates additional opportunities for us to target individuals who have a specific interest in getting vaccinated and get them to a location where they can be.
Thanks, Alicia. And we, for you all, the subcommittee, we wanted to provide this for you so you can have it as a resource. We know you guys are such awesome ambassadors for us. So this will be in the deck. And of course, at the end of the deck, we also have additional resources for you all to use. From the subcommittee, any questions or comments about any of the material we covered before we move on to public comment?
This is Joan. I have a question about the uptake in some of the towns and cities other than those referenced earlier. Is there a point in this process when you look at, say, one town being at 29% and everybody else at 40%, that you then shift focus to that specific municipality? I'm thinking specifically of Newport compared to Portsmouth and Middletown. Is there a point in this process where you might look specifically at certain towns or cities? And why they're not engaging more, accepting the vaccine more?
Good morning, Joan. Thank you for that. I can get started. We are doing that throughout, and being able to understand. We do have vaccination rates by zip code, and really across testing, treatment, and vaccination now. We're looking at what the uptake is and where we can make adjustments in improving that uptake, including for vaccination. From members of This subcommittee, we definitely welcome that type of feedback where there are concerns about uptake or ideas on how to solve for that. We certainly welcome. I know Dr. Chowdhury has been helpful with us with Woonsocket along those lines as well. So we welcome calling out where there are areas to recommend increased focus so that we can dig in there.
Good morning, it's Kathy from the Alliance. How are you? This question's for Alyssa. When the 2 ambulance companies go into the long-term care facilities, will they also vaccinate any employees that want that?
We're working on a contract modification for that right now, Kathy. So the answer is hopefully by the end of the week, yes.
All right, thanks.
Anyone else from the subcommittee before we dive into public comment?
Hi, this is Larry again. One data point that I'd be interested in if it wasn't presented earlier is as we expand the age bands and eligibility requirements, I'd be curious about the race and ethnicity breakout with each additional wave of openings. I think it's definitely helpful to see by time period kind of how we've progressed, but if it's not already represented there, I'd be curious to see what the breakout is by phase.
We will put in that request. We're continuing to look at different ways to represent data around race and ethnicity. So hoping to also get some new views of that out to you guys at the next meeting. All right, so one question we already answered in the chat was around homebound, Partners for Homebound. In the Q&A, there was a clarifying question about when we say 70% of people by May, do we mean fully vaccinated or at least 1 dose? And the answer to that is first dose by mid-May, fully vaccinated by the end of June. That's that 70% Rhode Islanders. Another question was how many people have gotten an appointment through the vaccine interest notification list? And Tom McCarthy responded, the first appointments from Vinyl are on track to go out on April 7th. Moving over to the chat. Scroll to the top here. Answered that question. There was a request to share the slides. The slides go into the meeting minutes, which are posted on the Secretary of State website. So take a look there for those meeting minutes. We had a question on which zip codes are tier 1 and tier 2. And further down the chat, Alicia went ahead and listed those tier 1 and tier 2 zip codes for anyone who would like access to that. I won't read them out. I don't think I'm as eloquent as Sheena and could deal with that tongue twister. Then we have, what's the status of the ACI and Wyatt, both officers and residents? And then another question about doing clinics on college campuses, since those seem to be hotspots. I'll pass it to Alicia, and then of course, Dr. Burke, welcome to weigh in as well regarding ACI and Wyatt officers and residents.
Sure, so Dr. Burke did answer the question a little bit further down in the chat, but I'm sure he can provide much better details about what's happening at the ACI. Wyatt, we have held several clinics at Wyatt for both the correctional officers and the folks who are incarcerated there, and they will become part of the ongoing maintenance process with our vendors so that as new folks are incarcerated or new staff members become are added who may need to be vaccinated, that opportunity will exist in sort of an on-demand fashion in the same way that it will for the nursing homes and the assisted living communities.
Dr. Burke, anything to add regarding the status of ACI?
Not too much. We've had pretty good uptake. Again, about 70% of staff, and that includes some of the contractors that are coming in and out, and 75% of the sentenced population. We are working now to start having Johnson & Johnson potentially coming in April for some of the more transient population at the intake facility where the stay is much shorter, and so it's a little more difficult to coordinate second doses, but we're still encouraging vaccination from both staff and then working on increasing it at the intake facility.
Great. And then the question was, will we be doing clinics on college campuses and really pushing that since they seem to be hotspots?
So we have been engaging directly with the Institutes of Higher Ed presidents. More of the focus, knowing about the hotspots, is on the communities that are surrounding the Institutes of Higher Ed, really staying, keeping our eye on the ball of keeping people out of the hospital and keeping them alive through the vaccination. But as supply continues to increase, we'll be able to accelerate the ability to get to the college-age students as well, particularly aiming for that April 19th timeframe. But I also want to give credit to the IHEs who have worked very closely with us. And when you compare what we learned from the fall semester with how we've been able to apply it this semester, everyone overall has done well in being aggressive and responsive from an outbreak management standpoint and keeping the percent positivity well under 5% across the IHEs. So that plus our ongoing vaccination as part of our eligibility rollout will be valuable.
Thank you. We have a question about drive-through vaccination sites. Are they being considered? The one done in Providence, VA, this past weekend went really well. So does anyone want to speak to any thoughts around drive-through vaccination sites?
Tom, do you want to jump in on that one? It's definitely an approach that we have valued, seeing that it has worked well with testing.
Yeah, absolutely. Thanks, Director. So we are going to continue to improve and refine based on what's going to be most impactful for Rhode Islanders. So we don't have any near-term plans for opening up a drive-through vaccination clinic, but it's something that we'll continue to reevaluate. We are looking at some properties and some opportunities to potentially be able to do that, but we've been receiving very positive feedback based on the locations we currently have, the accessibility and the experience that the teams there have been providing.
Thank you. This comment, I believe, was regarding the effort to drive more uptake and really get the word out about the vaccine safety. And the comment is that it would probably be a good opportunity to engage union leaders as ambassadors for others to get vaccinated. That's a great comment. Great idea as we continue to look for other ambassadors. Demand now exceeds supply, but there is an estimated or predicted date for the inflection point where that changes and supply exceeds demand, both in HDC, BIPOC populations, and overall. So is there going to be an inflection point where we estimate supply to exceed demand? Trish, do you want to take that one? How we're thinking about tracking that?
And Tom was ready to jump in too.
Oh, sure. Go ahead, Tom.
Yeah, I can get started there. So, we have a pretty good sense of what our allocations are going to look like, which have expanded going into the summer. So by the beginning of June, mid-June, we should be receiving about 100,000 doses a week in the state. At that point, we should also be reaching about 70% both doses fully vaccinated. So I think probably end of June, beginning of July is when we'll start to see more supply than necessarily demand. At that point, though, I think it's still critical that we continue to drive demand as high as possible, because I think one of the considerations we'll have at that point is it's unlikely we'll have a vaccine approved for those younger than 16 at that point. So in order to reach herd immunity, getting as many people vaccinated that are 16 plus is critically important. But I think we'll have more opportunities available to us because we have administration rates of excess of 95% each week now. We'll have a bit more breathing room at that point.
Another question, how can an individual currently eligible register or schedule a J&J vaccine specifically?
We are, sure, on our current website, you have the opportunity to see which vaccines, vaccinateri.org. If you go to that website and you look at any of the state-run vaccination centers, you can see which vaccines are currently being offered in those spaces. We are also just about to launch a GIS-based tool that would allow us to will allow any user to search by address or zip code for any of the spaces within a certain number of miles and you can sort specifically by vaccine specifically. So if you wanted just the Janssen vaccine, you can select just the Janssen vaccine. It will show only those places that are offering that vaccine. Also, that functionality obviously exists for individuals who are unable to use the internet, so folks can still call our hotline 222-8022 or 211 to get that information as well.
Thank you, Alicia. That question was from me. I should have clarified. This individual is a teacher that was very vaccine hesitant, and I'm wondering in some subgroups that we're trying to fast track with the schools opening. And all the slots using the PrepMod tool are booked for the next couple of weeks. What can I say to this teacher? Is there a way to expedite their vaccination?
Unfortunately, we have now opened the eligibility as of yesterday for all teachers and childcare workers to get added to the rest of the eligibility groups. So again, we encourage people to try as many opportunities as they can, especially if they know where the Johnson & Johnson vaccine is being utilized. Certainly our newly open sites are including Johnson & Johnson. Most of our retail partners, especially the new ones coming on board, Stop and Shop, Walmart, et cetera, are using Johnson & Johnson. So those would be the opportunities to try to seek out if there's a space near her.
Thank you.
This is a comment that I'll just read. At DCYF, workers were offered vaccines and then abruptly stopped well over a month ago, leaving many frontline workers not vaccinated. With 10% of vaccine not being distributed, perhaps the populations as state employees could be targeted, which would also improve rate of distribution. At BHDDH, social caseworkers have seen their clients with developmental disabilities for over a year. They have caseloads of 150 to 200 clients. DHS workers haven't had direct access to the most vulnerable populations and haven't had access to the vaccine.
I think there are a couple components of that. One, most importantly is as the supply in the state has expanded, increasing eligibility and making it more widely available, which we'll be able to do here into April, which will be able to address, most of these populations here. The other piece I wanted to comment on too, with regards to the administration rate, essentially where we are now is the only doses we have left over at the end of the week are the doses that we're planning on administering Monday and Tuesday. And that's just to serve as a very small buffer while we're waiting for our weekly allotment to arrive in the state. So, this team has done a fantastic job of, there is literally not another dose in the state that they could be pushing out at the end of each week. And that's why you often see appointments added throughout the week where they identify opportunities to reallocate to different locations, different eligibility groups in order to maximize that rate there.
Great. We have a question. Is the Cranston Sockinosset site fully accessible to people who are in wheelchairs? And yes, it is fully accessible to individuals in wheelchairs. There's ramps, bathrooms are accessible. There's also ambassadors to support individuals as they navigate through the process, should they need additional assistance beyond the accessibility opportunities there. When will tier 2 HDCs become eligible for the vaccine? Sheena?
Yeah, I can take that. We're still determining the exact date that will roll out. We just started our initial conversations with the leaders of those communities, and so that information will be forthcoming, but we hope that it will be soon.
And I think just the one clarifier there as far as eligibility. So really what we're talking about with HDC tier 2 is additional allocations specifically for those municipalities, those zip codes. So currently their eligibility criteria looks the same as the rest of the state, but what we'll be able to expand upon here, because by mid-April, everyone that can receive the vaccine will be eligible, is some additional specific allocations for those areas of the state.
Can the ambassadors, this I'm assuming are at the RIDO vaccination centers, can the ambassadors help someone with a transport wheelchair from the MTM car into the building and back out when completed if an individual is not able to self-propel in the transport chair? Mixed info online indicating there were stairs in the building. This individual is offering Deb from RA Elder Care to get this information better out to the channels that she serves. Alicia, do you want to comment at all about the ambassadors that are available at these sites?
Sure. So I know for certain that the ambassadors provide this service at the Dunkin' Donuts Center. I've just put out that question to one of my colleagues about the Sockinosset site, so I can't answer 100% confidently on that functionality at that site, but we can get back to you on that. I think it's a great call out. If information is confusing on the website, then we will take that back as a note and try to clarify that there.
Yeah, we can push that back out, but all of our sites are fully accessible, and there are people there willing to help, dedicated to helping there. So we'll clarify all of that messaging on the website and any other products we're pushing out there, but all of them are fully accessible.
Last question that we have, there was one more question that was answered in the chat and will be in the meeting minutes, and then last question live. Will more evening hours be added to the state-run sites to accommodate people who are working? Tom, would you be able to take that one?
Yeah, excuse me. So again, we'll continue to refine and adjust as needed to keep that demand high. There's additional flexibility with regards to hours at some of the pharmacy locations, which is almost half of the vaccination appointments, at this point are going through pharmacies, a bit less. But we'll continue to reevaluate, the need there. We do have dates on weekends, and we appreciate employers' flexibility, knowing that we're going through this critical time, and it's important that we get folks vaccinated as quickly as we possibly can. I do recognize, though, that as the state continues to open and people, beginning to return back to work in person, lose some of the flexibility that we've had as much of the state has been remote, we'll continue to reassess that.
Mackenzie, if I could just jump in, we did receive confirmation that the staff at the Sockinosset site are also providing that service from vehicles if anyone needs it to get into the building at Sockinosset.
Awesome, thank you, Alicia. And I think that takes us to the end. So thank you everyone for joining us today and everyone from the community who dialed in. Our next meeting will be not next Tuesday, but the Tuesday after, unless something else emergent comes up in the meantime that we would like to consult the subcommittee on.
And we really just, excuse me, want to finish with expressing appreciation to you as our subcommittee, in holding us accountable and helping to provide input and feedback, and then also in being ambassadors to this work. There is a tremendous amount that has been done that we are proud of and accomplishing together, and there is plenty more for us to do. We fully recognize that the driving demand piece is going to be something that's critical for us to focus on for the weeks and months to come. So we very much welcome and appreciate your partnership in helping us get there for the state. So thank you, everyone. Have a wonderful day.
Yeah, everyone.